myopia. Clear outline for the nearby object. Dim outline for the distant body. It is caused by the elongation of the eyeball or by narrowing refraction, so that the parallel rays are focused in front of the retina in stillness state of eyeball regulation. Myopia commonly occurs in adolescence. Pathogenic factors. Unhealthy habit in using the eyes, for example, too close to the object during reading or writing, abnormal sitting position, too poor or strong light, partially due to congenital deficiency. Treatment. First of all, correct the unhealthy habit. Read and write in a normal position. Keep a distance of 30 cm between the eyes and the book. Avoid reading in lying positions. Avoid reading during walking or reading in the bus. Moderate light, neither too strong nor too poor, is recommended. Avoid reading for too long. After reading 1 hour each time, take a rest and look far in order to relax the eyes. Body acupuncture. Select Jingming and Chengqi. Puncture 0.3 to 0.5 cun perpendicularly to promote the qi blood circulation of the local meridian. Select Yiming, Fengchi, puncture 0.5 to 1 cun obliquely to regulate the meridian and benefit the eyes. Combine with Hegu and Zhu Sanli of Yangming meridian to strengthen the spleen and tonify qi. Reinforcing technique is applied to the points mentioned above. Retain the needles for 20 to 30 minutes. Plum blossom needles. Slightly tap the points around the orbit and the neck region. Hua tuo jia ji, extra point along the spine for 3 to 5 minutes. It has the effect of regulating qi and blood of the eye region and functions zangfu organs. 1 to 2 times daily. Auricular acupuncture. Select the sensitive spot in eye region, liver, kidney, I1, I2. Auricular point pressure therapy is used by embedding seeds. Press the seeds 2 to 3 times a day. Hip feet massage. It can be done by doctors or by the patient themselves. The manipulation of pressing, digital pressing, grasping can be used. Pressing is applied from the point of Jingming along the supraorbital margin to Cizhukong, then along the infraorbital margin to Tongziliao. Press totally 6 times. Digital pressing, 传珠, 丝珠空, 太阳, 童子疗, 400 and 风池 are used with digital pressing by thumb tip in turn, 1 minute for each point. Grasping is done by thumb, index, and the middle fingers of the right hand to lift and squeeze 太阳 and 风池 points, 6 times for each point. It's more effective for pseudomyopia. One with genuine myopia should wear glasses in time to correct the vision. No matter genuine or pseudomyopia, look into the nearby and distant green plant every morning or evening to protect the vision. Conjunctive congestion with swelling and pain. It's an acute symptom of ophthalmic diseases pertaining to wind heat in TCM, which is commonly seen in acute pseudomembranous conjunctivitis, epidemic keratitis, and conjunctivitis. Main symptoms are red and swelling eyes, the feeling of foreign body in the eyes and burning sensation, photophobia pain, lacrimation, secretion coherence in the eyes in the morning. Pathogenic factors. Wind and heat caused by external pathogenic factors or flaring up of the fire of liver and gallbladder along the meridian. Treatment. Body acupuncture. Select Jingming, puncture 0.3 to 0.5 cun perpendicularly. Select Taiyang for bloodletting to dispel heat and relieve swelling. Select Hegu, Qu of the hand Yangming meridian respectively, puncture 0.5 to 1 cun perpendicularly to expel exogenous pathogenic factors and clear heat. Fengqi is punctured 1 to 1.5 cun obliquely to disperse wind and expel exogenous pathogenic factors. Reducing technique is used 1 to 2 times a day. Manipulation of micropuncture with small size 3-edged needle prick the vein in posterior ear to obtain little bloodletting, or prick 耳尖 for bloodletting, then slightly wipe the blood with an alcohol cotton ball. Press the punctured part as wiping the blood repeatedly until the bleeding stops. Treatment is given once a day. Tinnitus and deafness. Both are auditory disturbances. Tinnitus is characterized by ringing sound in the ears, which interferes hearing, while deafness is failing or losing of hearing. They may be present in influenza, otitis media, otitis externa, tympanic membrane perforation, or disruption, hypertension, auditory vertigo, intracranial tumor, etc. Differentiation of symptoms and signs. Clinically, it is divided into two types, excess and deficiency. Excess syndrome includes two types: wind heat caused by external pathogenic factors or caused by excessive fire of the liver and gallbladder. Wind heat caused by external pathogenic factors is characterized by sudden onset of tinnitus, deafness, accompanied by fever, aversion to wind, headache, red tongue with yellow coating, rapid and rolling pulse. Excessive fire in the liver and gallbladder is characterized by tinnitus and deafness, aggravated by depression and anger, accompanied by dry throat, bitter taste, vexation, and susceptible to anger. Red tongue with yellowish coating, rapid and wiry pulse. Deficiency syndrome is often due to deficiency of kidney yin, which is characterized by protracted deafness, tinnitus accompanied by lassitude in the lumbars and the knee, vertigo, blurred vision, red tongue with coating, steady and rapid pulse. Treatment. Body acupuncture. Select Yi Feng, puncture 0.5 to 1 point swing perpendicularly. And from Ermei to Qinggong, puncture 1 to 1.5 swing obliquely downward, with even movement method to promote the circulation of meridian and resuscitation. Wai Guan and Feng Chi are supplemented for exogenous pathogenic wind heat. Reducing technique is used to disperse wind and clear heat. Tai Chung, Qiu Xi are supplemented for flaring up of fire of the liver and gallbladder. Reducing technique is used to clear the fire in liver and gallbladder. Shen Shu, Guan Yuan, and Qi Hai, with Moxibustion are commonly supplemented for kidney deficiency, or with reinforcing technique of acupuncture to tonify kidney for filling up the ear. Magnetotherapy of point. 2 magnetic pieces with 800 to 1,500 Gausses are used, with their cathode and anode applied on Qinggong and Yi Feng respectively. Connect the other end with the electric acupuncture instrument. Use continuous wave. Electricity is given 15 to 20 minutes each time. It is effective for tinnitus. hydroacupuncture therapy. With 6542 injection. Inject it into Tingong and Yifeng, 0.5 to 1 ml each point, once every day or once every other day. Rhinorrhea with turbid discharge. Fetid, thick and sticky nasal discharge, accompanied by nasal obstruction, hyposmia or loss of sense of smell. It is similar to sinusitis. Pathogenic factors. The nose is the gate of the lung, and the rhinorrhea is related to the attack of pathogenic factors to the lung meridian. In the early stage, it is accompanied by headache, chilly, fever, superficial and rapid pulse. If it is a chronic case, there may be distending pain on forehead and eyebrow, vertigo, and nasal obstruction, etc. Treatment. Body acupuncture. Select Yingxiang, puncture 0.5 cun horizontally. Select Yintang and Cuanzhu, puncture 0.5 cun obliquely downward to promote the circulation of meridian and benefit the nose. Select Hegu, puncture 0.5 cun perpendicularly with reducing technique for clearing heat and expelling exogenous pathogenic factors. Extra point B-tone at the highest place of the nasolabial groove are punctured 0.3 to 0.5 cun subcutaneously with needle tip inward and upward. Feng Chi and Qu Chi are supplemented to disperse wind and clear heat. Treatment is given once a day, retain needles for 20 to 30 minutes. Hydroacupuncture therapy use injection calciferoli and calcicolloidally 1 ml and vitamin B12 100 mcg injected into Yingxiang or B-tone point, 0.5 ml each side, once every day or every other day. Toothache. The cause of toothache are various. Dental or peridental diseases may result in toothache. Pathogenic factors and differentiation of symptoms and signs. First, it may be due to abnormal fire arising along the Yangming meridian, as the stomach meridian goes into the upper gum, and the large intestine meridian, the lower gum. The accompanied symptoms are thirst, foul breath, constipation, red tongue with yellow coating, full and rapid pulse, etc. Second, it may be due to deficiency of kidney yin with flaring up of the fire, manifested as vague pain off and on, better at daytime but worse at night, loose teeth, red tongue with little coating, steady and rapid pulse, etc. Toothache due to invasion by exogenous pathogenic fire and wind is manifested by fever, chilly, inflammation of gums, Pink tongue with thin and white coating, superficial and rapid pulse, etc. Treatment. Body acupuncture. Hegu, the source point of large intestine meridian, is used as the main point to promote the qi circulation of yang-ming meridians for any types of toothache. Xiaguan is supplemented for upper toothache. Punctuate 0.5 to 1 cun perpendicularly with reducing technique. Yachi for lower toothache, punctuate 0.5 to 1 cun subcutaneously with reducing technique to clear fire of yang-ming meridians. Toothache due to deficiency of fire, select Tai Xi, punctuate 0.3 to 0.5 cun perpendicularly with reinforcing technique to nourish yin and reduce fire. The secondary point for toothache due to wind fire are Feng Chi and Wei Guan. Puncture with reducing technique to disperse wind and clear heat. Auricular acupuncture. Puncture ear shen men, triggers apex, occiput, jaw, and tooth with strong stimulation. Retain needles for 1 to 2 hours. Apply seeds after puncturing. Press the seeds repeatedly. Sore throat. Sore throat may be present in tonsillitis, pharyngitis, or laryngitis. The tonsillitis in TCM is called 乳额, the pharyngitis and laryngitis 喉壁. Pathogenic factors and differentiation of syndromes and signs. The type of excess heat is due to invasion of exogenous wind heat or accumulation of heat in the lung and stomach. The manifestation abruptly onset, dry throat, thirst, cough, headache, fever, red tongue with yellow coating, floating and rapid pulse. Deficient fire is caused by yin deficiency constitution and flaring up of fire. The manifestations are gradual onset, mild pain, uncomfortable swallowing, red tongue with little coating, thready and rapid pulse. Treatment. Body acupuncture. In the case of excess heat, Hegu, the source point of hand yang-ming meridian, is selected. Puncture 0.5 to 1 cun perpendicularly. Select Shaoshang and Shangyang and puncture them to cause bloodletting so as to clear heat and relieve pain. In case of fire caused by deficiency, select Tai Xi or Zhao Hai. Puncture 0.5 to 1 cun perpendicularly with reinforcing or even movement technique to nourish yin and reduce fire. Tianzhu, with its effect of benefiting the throat, can be punctured for excess or deficiency syndromes. Auricular acupuncture. Select point throat, lung, tonsil, helix 1, helix 3, and helix 5. Moderate to medium stimulation. Retain needles for 1 to 2 hours. Embedding seeds are followed. Manipulation of micropuncture. For the type of excess heat, bloodletting the ear, apex, or the vein of posterior ear is used to purge heat and relieve pain. Obesity. Obesity does not refer to well-developed muscles, increase of protein, fluid, and sodium retention, but refers to that the quantity of heat is more than its consumption. The extra quantity of heat turns to fat and accumulates in the body, resulting in overweight, 20% more than normal index. There are two calculating methods of obesity. One, actual weight is 20% more than standard weight. Two, body weight index is over 24. Pathogenic factors. It is due to overeating, lack of physical exercise, family inheritance, and endocrine disorder. Differentiation of symptoms and signs. The type of qi deficiency. Obesity is accompanied by general lassitude, palpitation, and breathlessness. Spontaneous perspiration, pale tongue with white coating, deep and thready pulse. The type of phlegm and dampness. It is manifested as dyspnea, with feeling of oppression in the chest, phlegm in the throat, lassitude, pale tongue with thick and white coating, rolling pulse. Treatment. Body acupuncture. For the type of qi deficiency, use Pi Shu, Wei Shu, 中脘、梁门、足三里、合谷、曲池、气海. Select 2 to 4 of the points above alternatively each time with reinforcing technique or with moxibustion or with warming needle. The treatment is given once a day to tonify spleen and strengthen qi. For the type of accumulation of phlegm and dampness, use 足三里、丰隆、三阴交、阴陵泉、内关、尺泽 and 太渊. Select 2 to 4 of the points alternatively each time with even movement technique for invigorating the spleen and removing phlegm and dampness. The treatment is given once a day. Auricular acupuncture. Select point kidney, spleen, mouth, stomach, lung, endocrine, and throat. Apply seeds. At the time 30 minutes before meal or when feeling hungry. Press the seeds for 1 to 2 minutes to reduce the feeling of hunger. And the amount of food intake. Diet control is beneficial to losing weight. The quantity of heat from food intake for an adult daily should not be beyond 1,200 calories. If feeling hungry, the quantity of vegetable or fruit intake should be increased. Constant moderate physical exercise will help reduce body weight, like climbing, swimming, playing table tennis, or keep fit exercise, etc. Stop smoking. Cigarette smoking is hazardous to the health. It may cause various diseases. Smoking is harmful not only to the health of the smoker, but also to that of the others. So, stop smoking is recommended. Treatment. Auricular acupuncture. Select ear, 神门, mouth, lung, endocrine, trachea, and 垂前. Use seeds. When there is a desire to smoke, press the ear points 1 to 2 minutes each time. After treatment, the smoker will feel bitter taste in the mouth, tasteless, and uninterested in smoking. Then reduce smoking or even stop smoking. Body acupuncture. Symptoms will be tastelessness, poor appetite, nausea, and salivation. Myasthenia, disconcentration, etc. These are called post-smoking syndromes. Select 合谷, 列缺, 足三里, and 三阴交 with reducing technique. Stop drug taking. Drug taking is seriously harmful to the health. After drug taking, however, one will feel joyful, so it is difficult for drug addict to stop it completely. If it is forced to stop, the patient may feel listlessness, general tiredness, salivation, poor appetite, perspiration, and lacrimation. Restlessness and upset. The patient suffers a lot, even feel being alive is not better than dead. Acupuncture can tranquilize, soothe chest disorder, regulate qi, resolve phlegm, and relieve depression. So the symptoms mentioned above can be alleviated or eliminated. Treatment. Auricular acupuncture. Select point ear 神门 kidney, mouth, external nose, spleen, lung, adrenal, subcortex, and endocrine. First of all, use filiform needle to puncture with strong stimulation. Retain needles for 1 to 2 hours. When patient feels discomfort or restless, twist, lift and thrust the needles. When patient is calmed down, use seeds. Body acupuncture. Select 水沟 承浆 合谷 内关 尺泽 足三里 and 丰隆 with reducing technique. Retain the needles for 20 to 30 minutes each time. The treatment is given once or twice a day. Improving looks. Being fond of beauty is a natural instinct of the human being. Acupuncture for making beauty is based on a theory that the facial muscle and skin are closely related to Zangfu organs, meridians, qi and blood of the human body. By acupuncture, to regulate the function of Zangfu and meridians, qi and blood, to promote the facial blood circulation, to improve the regular facial cells and the sebaceous metabolism, increase the elasticity of skin and muscles, beauty can be got. Corresponding meridian point selection. According to what the meridian distribution is suggested, for the treatment of the facial area is divided into 9 regions. First, draw 2 horizontal lines on the levels of eyebrow and the lower margin of the nose. Then 4 vertical lines are drawn along bilateral wings of the nose and the outer canthus, by which the points are selected along the meridian, the urinary bladder meridian. Second point selection. Select 印堂 上心 传珠 Distant point selection. Select 昆仑 尾中 The superior region of the eye pertains to the stomach and gallbladder meridians. Adjacent point selection. 阳白 Distant point selection. 阳陵泉 内庭 足临气 Area of frontal angle belongs to the stomach and gallbladder meridians. Adjacent points selection. 头尾 Distant point selection. 阳陵泉 内庭 Nasal region belongs to dual meridian, large intestine, and stomach meridian. Adjacent point selection. 印堂 素疗 and 迎香 Distant point selection. 合谷 内庭 Exo internal meridian point selection. 列缺 Zygomatic region belongs to heart, small intestine, and stomach meridian. Adjacent point selection. 全疗 400 Distant point selection. 养老少府 内庭 preauricular region involves stomach and sensual meridian. Adjacent point selection. 下关耳门 distant point selection. 外关支沟足三里 area around the mouth involve ring, dew, stomach, and large intestine meridian. Adjacent point selection. 地仓水沟澄江 distant point selection. 合谷足三里列缺 facial buccal area involves stomach meridian. Adjacent point selection. 颊翅大龈 distant point selection. 内庭足三里 Anterior and inferior air region pertains to stomach and sensual meridians. Adjacent point selection. 翳风颊翅 distant point selection. 支沟内关足三里 It is also recommended to do point selection based on differentiation of symptoms and signs. In the case of hypersteatosis, the therapeutic principle should be clearing away damp heat of the spleen and stomach. Puncture 足三里 内庭上星阴陵泉 with reducing technique. In case of facial acne caused by wind heat in the lung meridian, the therapeutic principle should be expelling wind and heat. Select 曲池合谷列缺 with reducing technique. If facial acne due to damp heat in the spleen and stomach, the therapeutic principle should be clearing away damp heat. Puncture 阴陵泉内庭 with reducing technique. If facial acne due to imbalance of Chong and J meridian, puncture 三阴交关元 with even movement technique. In case of increased wrinkly face or facial flaccidity, it should be reinforcing spleen, nourishing blood, and relieving the depressed liver qi. Puncture 足三里三阴交太冲太溪 with reinforcing technique mainly. In the case of lower eyelid swelling or paralysis, it should be invigorating and elevating qi. Select 百会足三里 with Moxibustion. Puncture 深脉足临气 and retain needles for 20 minutes. In case of melasma or klezma, it should be relieving the depressed liver qi, nourishing the liver and kidney, promoting blood circulation, and removing blood stasis. Select 太冲、照海、曲泉 gan shu, shen shu, with reinforcing or reducing technique, respectively. In facial acupuncture, use 0.3 to 1 twin filiform needles mainly. Puncture subcutaneously, horizontally, or obliquely. In facial moxibustion, pay attention to the control of heat intensity. Avoid burning the skin. Better result can be achieved in improving looks by combining with acupuncture and facial massage.
Yi路漫漫，披迹相伴。